health is the human face for climate change.
Intense heat, extreme precipitation, drought, floods, and wildfires. Climate change is a public health emergency.
With half the world's population living in cities and 70% projected to live there by 2050, we must focus on this.
You need to identify the vulnerable groups, who's going to be affected most by the pending crisis, and how do you get the message to them so that they can start looking at changing their behavior.
If you don't have the data, if you don't have the plans, then you can't be prepared.
Coordination is foundational to our work because we know that addressing the health-related impacts of a changing climate, the extreme weather it brings, is indeed a team sport.
We have the information about wind, humidity, temperature, but this information, if it is isolated from the decision making, it is useless.
So it's not necessarily climate change as an afterthought. Climate change is embedded in the thinking as to what we want our development to look like.
What can we do is just the meteorological community, the National Met Services, need to work along with the health community in a way that this information that comes from meteorology is translated into actionable information.
Being part of the Resilient Cities Network, being part of the C40 network, looking at sustainable development and raise the temperature, raise the volume on them at a national and international stage.
3 words or less. What's the one thing that you would like to see happen to make your cities more resilient?
Money.
Awareness.
Capacity. Leadership.
The tools are available and the stakes could not be higher.
We're very excited on behalf of the Rockefeller Foundation to help work with you to make this a reality.